Hi, my name is Yuri Cortez, and the patent that I will be presenting is Haemophilus influenza. What type of microbe can cause a disease, and if it is a bacteria? The Haemophilus influenza disease is caused by B bacteria gram-negative Cucubacilla. This bacteria does not have any nucleus in its larger domain in prokaryotic microbes. The bacteria is usually divided into capsule N and capsule strains. This it is not the same as the flu influenza, which is usually caused by virus. So HV influenza is a bacteria. What disease does this pathogen cause? This bacteria can cause many infections, whether they are mild or serious, from ear infection that are more common in kids, and to bloodstream infection that are more common in older people. And H influenza infects the blood or through surrounding the lungs, preventing you from breathing. Many of these diseases can caused by H. H. Haemophilus influenza are pneumonia, lung infection, bloodstream infection, meningitis, epiglottis, swelling in the throat, cellulitis, skin infection, infection arthritis, inflammation of the joints, and there are others diseases caused by H. influenza. And how is the disease transmitted? The disease is transmitted by respiratory drops. It is usually transmitted for close contact or infection. Person can be either from sneezing, coughing, or by closing conversation that will be inhaled. It usually causes an infection from areas where the bacteria enter. Even if a person does not have any symptoms, they can still spread since they are still carrying it. So even though the people don't have any kind of symptoms for H influenza, you need to be careful because they can still be carrying the disease and spread it to you or to other people. And what type of symptoms of this disease? The symptoms for phenium is fever, chills, cough, short breathing, difficult breathing, and swelling. And symptoms for meningitis is fever, headache, stiff neck, and nausea with or without vomiting. And symptoms of the bloodstream infection are usually fever, chills, excessive tiredness, pain in the belly, nausea with or without vomiting, diarrhea, exhaustion, short or breath or difficult breathing. And as you can see, most of the symptoms for this disease are almost the same. So you should go to a hospital and check to make sure to see what kind of disease do you have. If you have any blood infection, if you have phenols or meningitis. How long does the last in it can be disease be treated? And the disease can be treated. People that have been diagnosed with H. influenza disease usually take antibiotics for about 10 days to be able to treat infection. It depends on how grave the infection is. People with H. influenza disease may generally need care in hospital. Some of their treatment, breathing support, medical treat low blood pressure, wound care of the parts of the body with damaged skin. Even though with proper treatment, some H. influenza infection can result in long-term problems or death. For example, bloodstream infection can result in loss in limbs. Meningitis can cause brain damage or hair loss, and others will cause like death or other kinds of problems in your body. Is there is any vaccine for the disease? The H influenza has a vaccine that is called HIV vaccine that will only protect you from influenza type B. Even though there is a vaccine, it doesn't prevent you from a disease caused by the other types of Haemophilus influenza. If the disease the many are in the world, the Haemophilus influenza disease is more commonly developed in countries. The inside estimate of 47,000% in Europe for 5 years. Industry trading data available for Alaska and Gravilla, so it's basically most common in Africa than in other countries that don't have the proper treatment for the HIV. influence. And here my reference.